Hello and welcome to this video podcast from Vetstoria. This video has been prepared with the help of our resident vet Julian Poublon from the Lady Dane Veterinary Centre. Myxomatosis affects both wild and domesticated rabbits. It is a very contagious disease caused by a virus. Epidemic infections are common in the UK, especially at the end of the summer. Depending on the infected individual, myxomatosis can present in several different ways. However, there are two major different presentations of the condition. The classic form, the chronic form. The classic form is the deadliest. The course of the disease and the symptoms are very characteristic. Following a short incubation period, lasting around 5 days, affected rabbits develop a mild conjunctivitis and a fever. Within a couple of days, the eyelids swell up and a sticky purulent discharge develops. Similar swellings soon affect other body areas, especially the genital area and the face, with intense swelling of the nose and both ears. The facial swelling eventually triggers blindness and the swelling around the nose and lips, preventing normal eating behaviour. Very quickly, affected individuals lose weight and condition. Secondary infections usually develop in the chest, causing nasal discharge and severe respiratory difficulties. Of course, this form of myxomatosis also affects pet rabbits, and the symptoms are similar. Swollen face, especially the eyelids, the nose and both ears. Swollen genital area and respiratory difficulty. Rabbits showing these symptoms do die within 2 weeks of the start of the infection. Treatment is pointless, and we recommend to put to sleep affected individuals to avoid unnecessary suffering. The second form of the disease is called the chronic form. It usually affects rabbits that have acquired some resistance against the infection, and we commonly recognise this form in vaccinated pet rabbits. Unlike the classic form, most rabbits survive this syndrome when adequate supportive care is provided. The symptoms are milder. Instead of being affected with diffuse swelling, affected patients do develop discrete lumps called myxomas. Affected areas are pretty much the same. The eyelids, the nose, both ears, and the genital area. This example was a mild case with only one lump on the nose. Those lumps generally dry out and fall off the rabbit's skin. When that happens, it may leave a mark on the skin or a dent in the eyelids, as we can appreciate here. This, however, is of little significance and our patients usually recover well.